Yes.
Close.
I'm sorry, I can't get any further away.
Oh no, I meant my phone.
Okay. All right. You guys ready to start? Ready. All right. Here are two triangles. We have the urogenital triangle. It's called the urogenital triangle because we have our urinary system, the urethra, leading to the outside world, and as well as the vagina. It's the same triangle that you find in males as well. Back here we have the anal triangle. Okay. Here's the anal canal. Let's talk about the muscles that make these up. We have the ischiocavernosus muscle right here, the bulbospongiosus muscle on either side, and then you have the superficial transverse perineal muscle. This little blue dot right here is the perineal body. This is where all the muscles are anchored to for these triangles for the most part, especially the bulbospongiosus and the transverse perineal. This is said to be a outside stimulation area. Here's your external anal sphincters here to the outside world. Let's talk about some of the female anatomy here. Oh, for those of you who are reviewing the bones too, here are your ischial tuberosities, by the way, on either side. Okay? And then pubic symphysis is right here. Okay? Let's review some of this. I believe this model is missing the superficial layer of skin, so what we should see right here is labia minora. Okay? If you open it up, you notice there's this little hook right here. Okay? When you close it, that hook is right here, and that represents the clitoris. Okay? Looking inside here, we have the vagina. Sorry guys, I'm trying to hold it open. The vagina, leading to the cervix, which is the part that protrudes into the vagina from the uterus, and here's the uterus. Okay? Please do not get that confused with the bladder or the urethra. Here we can see part of the rectum leading to the anal canal. We have the internal sphincters here, and again the external on the outside. Okay? When our model is together, we can see the uterus right here. Here is the round ligament coming up. We can see the fallopian tubes or the uterine tubes leading to the ovaries right here. We also have a ovarian ligament connecting the ovaries to the uterus. It is right there. Okay? And then, for all purposes of our models, here is your broad ligament. Okay? Broad ligament right there. And you guys have, let's see, external ischial tuberosity, uterine tubes. The fimbriae are colored in a darker color right there. And if you want to talk about the actual parts of the uterine tubes, we will switch to another model. So give me 1 second for that. Clitoris, external urethral. The external urethral opening is part of, again, the urinary system, which we already covered. And it's going to be the external part of the urethra that leads to the outside world. The vaginal orifice, again, is the orifice, the opening of the vagina to the outside world. Labia minus or labia minor, again, we spoke about the cervix and the rectum. I'm just going through and making sure I got it all. Uterine artery and vein are not on here. We'll have to look at a different one. Oh, the other one I want to show you. You guys look all the way back here. See this ligament right here? That's the uterosacral ligament. It's going from the uterus back to the sacrum. Okay? Alright, let me switch real quick to a different model. Oh, I want that one. I want to put underneath. This is straight, you guys. Alright, it's ready? Is that, let me try focusing it a little bit more. Look better? Yeah? Yes?
Yes.
Okay. Here's your fimbriae again, your ovary, your ovarian ligament, broad ligament. here is your fallopian tube, and the fallopian tube has a couple spots to it. The isthmus is right here, and then we have the ampulla, which is this widened area over here. Okay, the fimbriae again, the ovary, broad ligament. Here's the uterus itself. The cervix is right here, and then that leads to the vagina. Okay?
Can you point to the broad ligament? Is it number 12?
Yeah, broad ligament would be this one.
Okay.
A little bit of 11 and then 12. Okay? Again, the broad ligament's made up of 3 different types of ligaments. Let's go to a 3D model of the female. Sorry, I don't mean to make it like complicated. Just so we can see it on other models here. Again, here's your urethra. Okay? Urethra leading to your bladder. Here's the labia majora, labia minora. Pubic symphysis right here. Here is the vaginal orifice, the vagina. This is your cervix right here, and this is your uterus. Again, we have your rectum. So again, women have 3 holes: the urethra, the vagina, and the rectum, or the anal canal. Looking on the inside here, again, we have that round ligament right there. We have the fallopian tubes, or the uterine tubes, going to the fimbriae. And then that little yellow right there is the ovary. And connecting the ovary to the uterus is the ovarian ligament. Okay? Does anybody have any questions about the female reproductive system? Oh, and this is a good model because you can see right here. Whoops, no you can't. See this red artery and blue veins? They're going straight to the ovary. Those are your ovarian ligaments. Or sorry, your ovarian blood vessels. Ovarian artery and ovarian vein. Any questions? No? All right, ready for the male? Okay. Does anybody? What page did I tell you guys to study? Maybe? Alright, video. Make sure you review page 887 to get an internal view of the testes, and some of our models show that very well. Looking at the external anatomy right here, we have the scrotum. The scrotum, here's the actual testes. Here's the epididymis. We follow that to the vas deferens, or the ductus deferens, okay? All the way over until we hit the seminal vesicle. Oh, tilt it up. This is where semen is produced, okay? If we look on the inside here, this is the ampulla, where the, well, it's going to be the ejaculatory duct, I apologize, where the vas deferens and the seminal vesicle empty into one tube, and then from there, the ejaculatory duct leads to the urethra. Okay, so we'll review that one more time. Testes, epididymis, where those sperm, oops, sorry, thank you. Scrotum, testes, epididymis, where those sperm mature and get their flagellum. You also have the testicular artery and vein. The vas deferens, and all 3 of these vessels are traveling in the spermatocord, okay, that pops out through the inguinal canal. Vas deferens, again, to the seminal vesicle where the semen is produced, okay, flip that over. The ejaculatory duct where the seminal vesicle and the vas deferens empty into the urethra, the prostatic urethra.
So that thing that it's in is the prostate?
Yes, this is the prostate right here. So we'll talk about that next part.
Okay.
Ready? Let's talk about the male urinary system that is connected to the genital system as well. All right, so here's the penis. We have the glands, and then the shafts of the penis on the outside. The muscle that you see here too, we're going to call that the bulbospongiosus muscle of the male. Okay, you can't see any of the other muscles. They show cavernosus or transverse perineal. On the outside, we have the bladder here, and then this is the outside of the prostate gland, right up here. Okay? Looking internally, we have 2 different parts or compartments of the penis. We have the corpora cavernosum and the corpora spongiosum. Remember, the sponge lives inside of the cave on the outside. This is what fills up with blood when the penis is erect. There are no bones in the male penis, at least in Homo sapiens. bladder again. Your urethra has different parts depending on what area it's in. So here is your prostate gland. So this is the prostatic urethra. And then as the urethra travels in the corpus spongiosum, it's called the spongy urethra until it leads out to the world. The inside here, these little holes are supposed to represent the seminiferous not seminiferous, the tubules. Brain fart. Anybody? Yeah, seminiferous tubules, right? Yeah. Okay. I was thinking vesicle. Seminiferous tubules where the actual sperm are produced. Okay. Oh, and the other really good thing about this model, do you guys see this little itty bitty circle right here? That's supposed to be your bulbospongiosus gland. Okay? This is what lubes the penis. Okay? I think that's it for this guy. I do want to mention real quick one more thing with the female, and you guys can record this. It's going to be super short though.
You turned it. It's like on negative right now.
Okay. I'll fix it in a second. Can I? Oh, I make my students work. You made that?
I heard it too.
What was that?
I don't know.
My timer for my
Oh, looking again real quick at our triangles. On your objectives list, you have the vestibular gland for the females. Okay? I get this exposure. Okay. If you look on on this side of the labia minora, what we have is the body of the vestibule, which is what this blue thing is, and then the vestibular gland proper, I believe, is the anatomical term for it. This one supplies blood to the labia minora, and this one actually supplies the lubrication, the yellow one, okay? So if I label either of these, you can just call them the vestibular gland, okay? They work together during arousal.
Vestibular what?
Gland. Okay? I think that should be it. That should be the last thing we have to go over.